I'm going to talk about the serial aerobic study, which is a randomized controlled trial on the effects of aerobic dance training on cognition, mood, and physical functions in cerebral small vessels disease. So far, there's a lack of approved medications for treating asymptomatic silent small vessels disease. So lifestyle intervention is a very important component in preventing the progression of cognitive decline and other symptoms in patients with small vessels disease. And since physical exercise has been shown to improve cerebral vascular reactivity, which in turn results in clinical improvement, we conducted a study to look into the effect of aerobic exercise on improving the symptoms in patients with small vessels disease. So the objective of our study is to investigate the effects of a 24-week aerobic dance training on cognition, mood, and physical functions in community-dwelling older adults with small vessels disease, and whether the effects are mediated by changes in cerebral vascular reactivity. So the study is a rater-blind RCT, and we have screened the patients clinically and also by MRI, and then they are randomized into the intervention group and also the control group. The intervention group consists of 24 weeks of aerobic dance, and each session lasts for 60 minutes with 10 minutes of warm-up exercise, 40 minutes of aerobic dance, and also 10 minutes of cool-down exercise. And they're designed such that we can reach 40 to 70% of the age-specific target heart rate. As for the control group, there is a weekly low-intensity seated stretching, as well as a monthly psychoeducation class. The purpose of the control group is to provide a comparable social contact hours between both groups of participants. So we selected the patients according to the following criteria. We would choose subjects who were at least 65 years old, was community dwelling, and they needed to have neuroimaging evidence of small vessels disease, which is defined by at least 2 lacunar infarct, as well or at least 2 of the white matter hyperintensity using the age-related white matter changes visual rating scale on MRI. And they also needed to have a good temporal window on at least one hemisphere for evaluation of the cerebral vasomotor reactivity by using transcranial Doppler. As for the exclusion criteria, we excluded patients with a history of stroke, dementia, and also other comorbidities such as CNS conditions, inadequately controlled psychiatric disorder, as well as some physical or sensory impediments. So at baseline, all the cardiovascular risk factors were measured, as well as the years of education and the baseline measures of cognitive functions, depressive symptoms, as well as physical functions. And there were no significant there was no significant group differences at baseline. For the results, our study showed that for cognitive functions, the aerobic dance training group performed significantly better in domains of executive functions, as well as learning and memory. So for executive functions, which is measured by the color trail test 2, as you can see in the graph here, the dotted line represents the control group, while the solid line represented the intervention group. The colored line showed that there is a significant improvement compared to baseline. So at week 24, there is the intervention group performed significantly better than the control group. As for learning and memory, we also observed that the intervention group performed significantly better in the domains of verbal delay recognition, as well as the nonverbal memory. For depressive symptoms, although we could not see any between group differences, but there is a significant reduction in depressive symptoms in both groups. And we observed that the treatment groups had an earlier significant reduction at week 12, but the control group only improved at week 36. Concerning physical functions, the functional mobility, which is measured by the time up and go test, showed that the treatment group had a significantly better performance at week 12. And surprisingly, for walking capacity, which is measured by the 6-minute walk test, there's no significant between group differences. Using the full mediation model, none of the changes in cerebral vascular reactivity significantly mediated the relationship between treatment and outcomes. However, we also performed linear regression models, and we observed that the improvement in cerebral vascular reactivity actually correlated with some of the changes in some of the cognitive measures in the treatment group. We also perform an ApoE genotyping, and it is found out that for ApoE epsilon 4 carriers, they had a significantly less treatment benefits compared to non-carriers, especially in domains of memory, attention, and also language. At baseline, we also measure the white matter hyperintensity volume. And the study showed that the higher the white matter hyperintensity burden, there is more beneficial effects brought about by aerobic exercise, especially in the measures of processing speed, executive functions, and language. So they are more sensitive to the benefits from the aerobic dance training. Concerning the safety of the study, we found there is a total of 26 adverse events reported during the study, and the only event that is defined as possibly associated with the intervention is an event of plantar fasciitis, which occurred in the treatment group. In conclusion, a 24-week structured aerobic dance training is a feasible and potentially efficacious intervention in improving cognition, mood, and physical functions in community older adults with cerebral small vessels disease. And also, ApoE epsilon 4 carriers and higher white matter hyperintensity burden are associated with more benefits. There was evidence that clinical benefits were associated with CVR in the treatment group, but it did not significantly mediate the relationship between the intervention and the outcomes when we look at the full mediation model. I would like to take this opportunity to thank our study physiotherapists, as well as the research team at the Division of Neurology of the Chinese University of Hong Kong. So this is the end of my presentation, and now it's the time for discussion and questions.